We talk about inhalers all day, but no talks about what's on the plate. That's the conversation I want to have with you here today. Hi guys, welcome back to RTs Share Tea, where respiratory therapists live out loud. With me, your host, Linda Fry, the Asthma Lady. Yes, welcome. Thank you everyone. Welcome to anyone new. And today we are talking about the role of nutrition and asthma management. Before we go into the deep convo, I want to say thank you to everyone that wished me a happy Respiratory Care Week, which was this past week. And for those that shared their love and gave me a shout out during the 4th anniversary of the RTs Share Tea Podcast. Just want to say thank you to all you wheezers out there. All right, guys, so let's talk about this. And just want to let you know that this episode is mainly geared towards parents, caretakers, and community leaders, public health educators, and really just having more conversations about what's on your plate in regards to asthma management, right? So having a more holistic approach to asthma control. All right, so a quick overview of what is asthma. Asthma is a chronic lung disease of the airways, right? So what's happening is we have inflammation. So the airways on the inside is more narrow because it's swollen, and we have increased mucus production. And on the outside, the muscles around the airway get tighter, also contributing to the narrowing of the airways. So this makes it difficult to breathe for those with asthma. There is no cure for asthma yet, but there are things that we can do to help control our asthma. And once asthma is controlled, we can do whatever our hearts desire. There are 2 types of asthma. We have type 2 asthma and we have non-type 2 asthma. Type 2 asthma is the most common type of asthma, where it's the one caused by allergies, allergic asthma, and those with severe asthma, medications such as biologics can really be helpful. So the one we're going to be talking about in today's episode is non-type 2 asthma. So this is the one that's more not associated with allergies. Non-type 2 asthma is triggered by poor air quality, food preservatives, tobacco smoke, stress, strong emotions, smoke in the air, and obesity. Treatment for non-type 2 asthma strongly relies on lifestyle changes and behavioral changes. Let's talk about childhood obesity and inflammation connection. Extra fat tissue releases inflammatory chemicals in the body, and the body stays in a low level inflammation mode for like 24/7. So with that being said, we already have some internal increased inflammation even without being triggered. So this is why discussing things like nutrition shouldn't be just a side note or just as something quickly to mention. It can actually be an asthma intervention. So what's on your plate can be anti-inflammatory or pro-inflammatory. So discussing nutrition and the types of diets that help asthma control is important. We're either feeding inflammation or fighting it. There is evidence out there, such as the Canadian Journal of Cardiology, that shows that there is evidence that increasing the intakes of fruits and vegetables does have a positive impact on asthma management. And the article also mentioned how the intakes of these fruits and vegetables can also lead to improved lung function, and displaying that through pulmonary function tests, breathing tests, and within volumes of FEV1. So with all this talk about fruits and vegetables, so what is the premium diet of choice for someone with asthma? The best diet is, drum roll, a Mediterranean diet. Yes, one full of fish, vegetables, and fruit. So what we're looking for, especially with children, is to increase the intake of fruits and vegetables by 2 or more servings per day. And parents, we're also looking for the decreasing sugary foods, sugary drinks. So we want to decrease this by 2 or more a day. Decrease the intake of milk, except for babies, right? And for us Black or brown folks, making sure that we are getting that extra vitamin D that we are usually lacking. Oh, and if I didn't mention soda, we absolutely want you to cut down on all soda. Guys, I also want you to know, while we are talking about this, I also want to let you guys know that we are empathetic. So we know that not every family can afford to have a Mediterranean diet. And so we also have to be honest when it comes to about food insecurity, right? So now in most hospitals and outpatient ambulatory care settings, we are asking those type of questions because we know that food insecurities, not having access to quality food, can absolutely be a barrier to asthma control. So it is known, the research shows us that it is 148% chance that someone or family members will not pick up asthma medication if they are having issues with putting food on the table. This is well known. So what we do is we tell people who are having issues with gaining good quality food is to reach out to food pantries and ask for help. Go to social workers, go to your Department of Health and ask for the resources. It's things like SNAP and WIC for those that have children under 5, if they have access to WIC, to help out with food. We do know that this is across the country a barrier for asthma control. So if you are having these problems, please reach out. All right, guys, so I want to talk to you. Let me know, have you tried changing your diet to help manage your asthma? Have you tried it with your child? Have you talked to other people about, their vegetable and fruit intake and how this has helped them in any type of way? So let me know what you are seeing, right? So we've seen those green juices. How do you feel? Have you tried them? So yes, let's continue this dialogue. All right, guys, I hope you learned something here from me today. Know that we are growing together. I'm always here serving the tea, and now you can buy me a coffee. If you have learned anything, gained anything, you can tip now on the digital digital tip jar, buy me a coffee. All right, guys, we are here every week on most podcast platforms on Wednesdays, except for when I'm on vacation. And we are on YouTube on Thursdays. So much more to come. I'll see you next time. Bye.